Hi, I'm Carrie Schumacher. I work at the Institute for Adolescent Trauma Treatment and Training. I'm the project coordinator here in the School of Social Work.
Can you tell us a brief description of what your organization does?
Sure, so we are funded through the Substance Abuse and Mental Health Service Administration through a federal grant, and our primary network is the National Child Traumatic Stress Network. So what we do is provide trauma-informed care for the Long Island, New York metropolitan area. And there's a few different pieces of it. So we do workforce development, which is where we tie into the School of Social Work. We put in a trauma track for advanced year MSW students.
Where did you get your social work degree?
So I went to Adelphi for my master's degree, and I graduated in 2012. And then I took the postmaster's certificate program in advanced trauma treatments here as well.
What is your level of practice?
So at the Institute, it hits upon 3 levels. So at the macro level, we work nationwide. We're part of the National Child Traumatic Stress Network. And there's 60 other grantee sites that we collaborate with. We also run the Complex Trauma Work Group. My one director, Mandy Habib, is the co-chair. And that works with professionals all over the country. We also coordinate with different universities, anywhere from USC to Northwestern, to UMass, to a bunch of other states as well. On the meso level, we work with a lot of community-based organizations, and we really try to collaborate with as many Long Island-based agencies as possible. And we also widened our scope to the Hauppauge campus and Manhattan campus, so not only the Garden City students. So that was good. As for the micro level, our co-partner in this grant is Mercy First, the residential over in Syosset. And when we roll out the evidence-based treatment models, we implement it with the youth, and we do data tracking and assessments on those youth, and we also work clinically. So I run groups over there as well.
Okay. What drew you to this kind of social work?
So I think it started with coaching sports throughout my undergraduate. So I was working with a lot of adolescents, and it kind of made me realize the importance of mental health along with everything else. Also learning that children are one of the biggest oppressed populations, which people don't always realize, so that I could bring trauma-informed care and work on that many different levels is a big deal to me. So when I applied for this job, and it highlighted kids and adolescents and really finding models that work for them with different types of traumas, singular versus complex traumas, is what really made me gravitate towards this specialization.
What benefits come out of being a social worker for you as an individual?
For me, well, I'm very altruistic and I'm pretty outgoing, so social work kind of meshes well with my personality, and I feel that brings me a lot of fulfillment and joy for my job, even on days I'm really stressed out. The fact that I am impacting things on such a wide variety of practice, I guess, on all different levels, it's kind of, it just fit me well.
Being a social worker for you as an individual?
So I guess the biggest thing is when I go to work, it doesn't always feel like work. So right now, I think since it's spread across clinical research, community-based, and on the macro level, that burnout is low. And I know sometimes in other fields or career paths that I might have chosen could have had that. And this one too, needless to say, but I think that benefits me a lot. The fact that I like working with adolescents, and that's who this grant is geared towards, fits. So that's helpful too.
What is your specific position responsible for?
So as a project coordinator, I coordinate all the different evidence-based trainings that we hold through the network. So I recruit community-based organizations, I screen them, I do phone interviews with them, I make applications for them. For the trauma track, I basically screen MSW applicants who fill out the application form and get them going. and match placements for them and find placements for them in conjunction with field. And then over at Mercy First, our co-partner, I do the research and tracking for our research project with them and do some clinical work over there. Within our network, we are running 2 different collaboratives, a Sparks collaborative, which is a group treatment model for complex trauma and trauma-focused CBT, and I organize those trainings, and now, since the trainings are over, they're running consultation calls. So I kind of track the consultation calls, I take notes on the consultation calls, so I coordinate the phone calls as well.
What?
You got it.
I can't say this. What would you change about your organization?
Let's see. I would give them more funding, and I would extend our grant for more than our 4-year cycle, because I think what we're doing is making a big impact on Long Island and the New York metropolitan area, and I wanted to see it continue, and even just seeing how far we've come just within the School of Social Work and workforce development, and really graduating students with certification evidence-based models is just such a beautiful thing to see. So I would want to continue that and kind of re-up the grant and just keep it moving forward.
Thank you.
Thank
so
you.
Yeah,
much.
you're welcome.
Yeah.